Everybody, well, thank you for joining us this beautiful Saturday morning. We're in Connecticut. Some of us are in a different state of Texas, and I'm sure all over the United States. People should be filtering in as we go along. So I just want to thank you for joining us. Thank you for joining the Born Rich Foundation's weekly workshops. These are the health and wellness workshops with registered dietitian James Jlucas III. I've known James for many, many years. We both grew up in Hamden, Connecticut, attended Hamden High School. He was a star athlete. Both went to the University of Connecticut together, where he just propelled in sports nutrition, and he was always into fitness ever since we were young. And so a little bit of background on James before we get started. He's humble, so he won't tell you this, so I'll be the one to do it. James has over 10 years experience as a registered dietitian. Is a certified specialist in sports dietetics, exercise physiologist, and he is the owner of James Jlucas Nutrition, which offers comprehensive, realistic meal plans and nutrition advice to help optimize your health, wellness, and athletic performance. As I said, James and I attended UCONN, where he graduated with a bachelor's in nutrition sciences and a minor in nutrition for sport and exercise. James also worked several years at Yale Cancer Hospital as an oncology dietitian, working with cancer patients, athletics, and focuses on individual nutritional needs. Currently resides in the Dallas-Fort Worth, Texas area, and can be found on YouTube and Instagram at J. Jlucas Nutrition. He also has a book out now called Hip Hop Nutrition Volume 1. I'm pretty sure you can find it on Amazon, but I'll put a link in the description in the chat box. So James, without any further ado, I want to welcome you to Health and Wellness, Eating for Immunity, and thank you to the Ballheads nonprofit, and also sponsored by the Born Rich Foundation. So thank you for supporting the Born Rich Foundation in our weekly seminar. So James, I'm going to leave it up to you.
Thank you, Rich. Can you hear me okay?
Yes.
Awesome. Happy Saturday morning to you all, and welcome to Eating for Immunity. This is a very interesting topic and can be either very detailed or very simple to discuss. But when we're talking about our immunity in general, it is a very complex system. You know, we walk every day as one unit, but there's billions of cells that are active, on a daily basis, that are helping us to, fight disease and fight the risk for getting sick on a day-to-day basis. I know that this topic is timely in relation to what's happening right now, and I hope that I can give you some information to help further strengthen your immune system to help with optimizing health. So I'd like everyone to just have your chat box ready. I will ask some questions as we go forward. And just to give you an outline in relation to our discussion today, I'll be talking about general immunity. Again, I'm not a doctor. Always check in with your physician before making any dramatic changes to your diet or lifestyle. And again, immunity could be a very detailed topic, and there's a lot of intricacies, but I'll just touch on general immunity and how the body works from that perspective. I'll primarily be focusing on nutrition in perspective of your diet, the types of foods you eat, how specific nutrients may have an influence on immunity, whether in a positive or negative way. And then we'll get into some supplements. I know that there are some popular supplements that people take, like echinacea, for example, vitamin C. And we'll talk about some of the literature around those products and the efficacy as far as if it works and if it's worthwhile to take it. We'll then touch on exercise a little bit and how that also affects your immune system. And then we'll get into a little summary discussion, Q&A. So we have about 50 minutes and we'll get into it. So before we start, I'd like to have you all tell me, what does immunity mean to you? So if you can type into the chat box, tell me, what does immunity mean to you? What is immunity to you? Type some answers in myself. So I'll give everyone about 30 seconds to type in some responses. Immunity is the ability not to get sick. Absolutely. Thank you, Karen. Anyone else? What does immunity mean to you? To protect my health, being healthy, good health. Thank you, Anna, Olympia. Robin, your body protecting you from disease and infection. Absolutely. Clifton, thank you for joining. Immune system, strength, and health. Robin, and on all, thank you for your responses. So without further ado, immunity basically is your body's defense system. Basically, it's your weaponry, right? On a day-to-day basis, our body is moving throughout the environment, and we have these microbes, different bacteria that are invading our body, and we're basically fighting off these invaders on a day-to-day basis. And based upon your health and your fitness, it will determine your ability to fight off these infections that come on a day-to-day basis. And there's no way that we can stop these different microbes or bad invaders. They're within our body all day, every day. It's just based upon our tolerance to these different bacteria determines if we'll get sick or not. So on a day-to-day basis, it's like we're just fighting off these diseases. We're knocking them out one by one. I like to think about it like something like this video here.
I don't know that one.
Let me pull this up real quick. So think about invaders coming into your home. It'll determine if you're ready to fight based upon how prepared you are and what your weaponry looks like. Kind of similar to one of my favorite movies and a classic here. I'm sure. So when you're thinking about, you know, these different invaders coming in, it's like our weaponry, you know, your machine guns, you know, et cetera. We're fighting off these different conditions. We got to have ammo to fight these invaders that are coming within our body on a day-to-day basis. So what can affect immunity? Drugs, whether illicit or drugs from a medication perspective, can have an influence on our immunity. Also, alcohol intake can influence the immune system. Our diet can influence our immunity. Heavy exercise also can affect our immunity. In addition, the wintertime, we know that during the wintertime, there's more colds, more flu. In relation to COVID-19, there's a prediction that during the fall and winter season, there could be a spike in COVID-19 conditions. Also, we have to remember that the flu usually mutates and becomes stronger with each season. So it's really important for us to focus on our immunity now and optimize upon it so that we're prepared to keep this fight going on a day-to-day basis. Additionally, any psychological stress, anxiety, depression, those factors can also suppress our immune system. If we're not sleeping enough, think about it. Our immune system is working and it needs time to rest as well. So if we're not resting enough, when we have these invaders that come in, we won't be able to be like Scarface to hold up that machine gun because you're going to be lethargic, which makes it more of a probability that those invaders will get into your home and that you will get sick. Additionally, any, say, long haul traveling across different time zones, that can also affect your immunity. For athletes, this is a very important factor. Business folks that are traveling, there's very specific interventions that you can use to help optimize sleep, reset your circadian rhythm, and optimize on your health. So we want to be mindful of all of these environmental factors that could influence your immunity. Any one of these that you're focused on or that you think about on a day-to-day basis, feel free to type it into the chat. Any questions that you might have around diet or any of these other factors, and I'll try to get to it as we progress through the presentation. So again, the immunity is super complex, and I won't get into a lot of the nitty-gritty details, but essentially we have a play in our immunity where we have resistance, to these bacterial infections that are coming into our system on a day-to-day basis. And based upon our rest, based upon our exercise and those other factors, it determines if we will win the battle or not. There are other factors that also may cause hyperimmunity, where your body's fighting so much that it actually causes more damage, and you have what's known as free radical production that increases tissue damage, where there could be an increased risk for disease. When we're thinking about, say, COVID-19, for example, there is what they call hyperimmunity, where you have an increase in all of these immune factors. The body's fighting so much that you end up with a lot of inflammation. I'm sure that you've all heard of that concept, where the white blood cells and all these other cells, they're fighting so much that it's actually causing more damage to the lungs or the gastrointestinal tract or other organs of the body, where it fails over time. We know that nutrition could play a big role in supporting those factors. And to the right side, we want to have more of that tolerance, right? We get the bacteria that are coming in and our body acts in a specific way, working with all the different metabolites to control the disease and mitigate the risk for an infection or disease. Now, one of the most important factors when it comes to diet is your gut is the most important factor in relation to your immunity. Think about it. We're drinking food, eating different foods on a day-to-day basis that has bacteria on it, and our gut needs to be strong. That's the first line of defense, so that it can break down foods in the right way and not allow those bacterial particles to be absorbed into the bloodstream. So 70% of your immunity lies within your gastrointestinal tract. So when we say you are what you eat, this is really the concept that we're describing. So when we look at the diet, for example, when you have a rich, balanced diet that's very diverse in fruits, vegetables, some proteins, the right types of fat, that helps to support a normal immune process and keeps the lining of the gastrointestinal tract the gastrointestinal tract aligned, so that you're fighting these different conditions in the right basis, versus when you have a poor, unbalanced diet, now those invaders have more of an opportunity to get by your first line of defense. Think about your diet like the fence around your home, right? If you're taking care of your diet, your fence is aligned, it's strong. You got the picket white fence. It's intact. It's 6 feet high, so that invaders can't jump over it easily. But when you're not eating a good diet, that's where you have more, say, gaps in your fence, where you can get more invaders coming through. Now they have a better opportunity to get into your home. They're closer to the door where they can break that door down. So we want to eat, plenty of fruits, vegetables, and other foods, so that we maintain the integrity of the gastrointestinal tract. For example, this here gives a picture of the lining of the gastrointestinal tract, or what they call the lumen, right? And we see that those little finger-like projections, they're called microvilli, and they basically absorb nutritional components and digest nutritional components. So we see that alcohol, sugars, different medications, et cetera, can either have a positive influence on those microvilli or a negative influence, where those bacteria, we don't want them to get past those little junctions. We don't want them to get into the body, right? But if it so happens that some of these factors get through, because every once in a while we get a little bit of these invaders that cross that intestinal lining, that's where our defense mechanisms come in. So think about these yellow guys as your machinery, right? So it's like, oh, someone got into our body. They actually say that the gut is actually outside of our body. Well, once they get past that, the body will see it and they'll start to take them out. Boom, one at a time. Boom, boom, boom. The white blood cells are active. Oh, what's happening right here? Boom, right? It's taking them down one by one. But if you get too many of those bacteria and you don't have enough weaponry to take them down, that's when you get sick, because they're getting past your defenses. Now they're getting into your bloodstream, And your body's like, oh, now we got a condition that we have to fight over time. And it's so important that that fence, the lining, is intact. And you got to be like Mike Tyson, basically, when it comes to your diet, your exercise routine, so that you're staying in shape and you're ready for the fight. So I have another little quick video so that you can picture, oh, what happens, say, when you have an invader, right?
This is Houston. Say again, please. Houston, we have a problem.
So that video there basically depicts your body's basically alarming you when those invaders come in. Like, Houston, we have a problem. You know, something went wrong. And that's where you get these cascade of events where your body starts to fight these infections. Now we have that acute response that we use by, say, providing antibiotics, right? You have these bacterial infections. Here's some antibiotics to treat the condition. Well, antibiotics can only work but for so long in certain circumstances. For example, we know that there's hospital-acquired infections and conditions that develop, and there's now antibiotic resistance where the body and these invaders, they start to dodge and duck, you know what I'm saying? These different antibiotics that are coming in, they're like, oh, I'm too smart for this, you know what I mean? I'm getting smarter. So those antibiotics, you keep throwing them at the bacterial infections, but they still thrive. And in fact, I think there was over 75,000 people that died last year as a result of antibiotic resistance. But again, we want to focus on primary prevention, starting with good diet each day so that we can rely less potentially on antibiotics. Secondarily, we may need antivirals. For example, we know we're in a crisis right now. You know, this antiviral to fight COVID-19 as an example. There are some things that our body we're not equipped to fight those infections. We're not familiar with them. Our bodies aren't trained to fight those infections. We don't have any antibodies to those conditions yet. So we need to take those immunizations at times to fight those viral infections. And then we have antifungals, where we might put some ointment on the surface of our skin for, say, psoriasis or some different inflammatory conditions to fight fungal infections. Now, secondarily, this is your innate host immunity. Again, it's so complex. This is where your diet, your exercise, your rest, and how you've been treating yourself over a long period of time can have an influence on your defense mechanisms. Now, when we're looking at diet and immunity, there are some very specifics that can have an influence on supporting your immune system. Your overall diet certainly can have an influence on inflammation and anti-inflammatory metabolites. We want to try to consume a diet that's going to be more anti-inflammatory. Secondarily, when looking at the Western diet, we know that it's higher in saturated fats, trans fats, proteins very high. We might have low fiber from poor fruit and vegetable intake, which could have an influence on the lining, the mucus layer of the GI tract, which can increase the risk for those invaders. So you want to have a lot of diversity in your diet. And we know that by choosing fermented foods, kombucha, sauerkraut, things of that nature, that increases the acidity and helps to support the gut microbiota. We'll get into that concept in a moment. Also, fruits, vegetables, fish, they're also supportive of the GI tract, and they have been affiliated with reducing allergic disease. There's also some benefits that have been demonstrated from some soy foods that can help reduce CRP, which is an inflammatory factor, C-reactive protein, which when looking at COVID-19, this is one of the first indications that you may have the condition, or it's one of the metabolites that is increased in your body. The CRP goes way, way, way up. So perhaps, you know, eating a diet more rich in these factors can help reduce the pro-inflammatory state. Additionally, we know that nutrition is important to help with clearing viruses, bacteria, and other pathogens. Nutrition also influences your susceptibility to catching an infection, and it has an influence to your body's response to an infection. Our macronutrient intake, our carb intake, fat, proteins are involved with the immunity and are important to create protein factors that activate the CRPs and acute phase proteins and other immunoglobulins. So you want to have an adequate balance of all of these factors. From a micronutrient perspective, we know that vitamins and minerals also play a role in supporting our antioxidant defenses. Now, when you're talking about antioxidants, that word gives an indication that it's helping to reduce oxidation of tissue. So when you're talking about reactive oxygen species, certain foods, high alcohol intake, smoking, a poor diet, high in saturated fat, those foods are more oxidants. So what they do is they break down and they damage the tissues around our body. But when you're consuming more foods and nutrients that are rich in antioxidants, like blueberries as an example, they have an antioxidant defense mechanism, meaning it will protect the cells and quench those free radicals from those poor foods or say alcohol, tobacco intake to help reduce the risk that it will cause cell damage, replication, the risk for cancer and things of that nature. Now, when we're looking at a deficiency in these foods or nutrients, that's when we're more susceptible to getting sick or having an infection. Kombucha, absolutely. Someone in the chat. Now, based upon where we are right now, I'd like to just do a chat check-in. If you can maybe tell me what's one of your favorite nutrition immune foods based upon what we've discussed from an antioxidant perspective. Any fruits or vegetables that you enjoy, that you recognize as being powerful for your health? I'll give everyone 30 seconds. Think of colorful foods, fruits, vegetables. Any powerful antioxidants you maybe have for breakfast this morning? Blueberries, definitely. Raspberries, Brussels sprouts, red peppers. Absolutely. So there's a few foods that some folks have mentioned, and we'll talk more about what's out there. So as you put more of these foods into your diet, you want to be more like Tyson as you're eating these foods. You're a beast as far as your immunity is concerned, so that now when these invaders come at you, you can duck, and boom, you hit them back, knock them down. That's the way you got to be. Think about your diet like Tyson. It's got to be adequate in these fruits, vegetables, and other nutrients to keep you thriving. Now, these are the foods that can increase the susceptibility to illness. And there's something called advanced glycosylated end products. These are components that are developed from proteins and fats that become glycosylated as a result of exposure to sugars, in addition to the way that foods are prepared and cooked. These are biomarkers that have an indication for degenerative disease, specifically like diabetes, atherosclerosis, chronic kidney disease, and Alzheimer's. Now, when you think about diabetes, for example, there's hemoglobin A1C that many of us may have had checked by our doctors. And this is a factor that looks at how much of these glycosylated end products are on our red blood cells. And the glycosylated end products, basically, they cause damage throughout the red blood cell system or throughout the circulatory system. So with diabetes, for example, if you have more of these advanced glycosylated end products on the red blood cell, as it's circulating around your body, it's causing more damage, right? You get more atherosclerosis because you have these dead tissues on the red blood cell. They're jagged edges on the red blood cell causing damage. Now you get scarred tissue in your circulatory system, which builds up, causes blockages, which can increase the risk for heart disease, chronic kidney disease. It could affect mentality, Alzheimer's. Also, it can increase the risk for blindness and other factors, right? Diet directly has an influence. We know that these advanced glycosylated end products can affect the lining of the gut. This advanced glycosylated end products are developed by the way we prepare foods, right? So grilling, frying, roasting meats that have a high fat content, consuming highly processed foods, fruit juices, high fructose corn syrup, and fizzy drinks have an increased influence on affecting the advanced glycosylated end products. Additionally, we can prevent these advanced glycosylated end products by preparing our foods in a different way. So steaming, boiling, slow cooking, using a crock pot, also putting some acids on our foods before we grill them. I know grilling season is coming up, so you can marinate your meats beforehand in like a salad dressing or lemon or lime. That will help to reduce those advanced glycosylated end products or carcinogens and help with supporting overall health. Including many vegetables with your grilled foods is the way to help prevent the absorption of those advanced glycosylated end products. And also think about the fruits and vegetables being a protective mechanism. It's like soiling the garden, right? When you soil the tract with the fruits and vegetables, now when you consume some of these AGEs, it won't have as much of an influence on your GI tract. So you can still consume and put these foods in your diet. Every once in a while, we all get a taste for a donut or some French fries. Even I eat them every once in a while, but you want to make sure that you have some fruit and vegetables that you're consuming throughout your day so that you're counteracting the negative effects of these food sources. So now we'll get into a little bit more specifics. There are some nutrients that can have a very powerful potential role on influencing immunity. For example, there are prebiotics, which are food components that are found in fibrous food sources. These prebiotics are nutrients that activate the healthy bacteria in our gut. It helps the healthy bacteria in our gut grow, right? Foods like, say, psyllium or foods from fruits and vegetables, as an example, they're higher in these prebiotic fibers, and they actually may selectively stimulate the growth of beneficial bacteria and might offer protection against the effects of AGEs. Having a higher fiber diet between 25 to 31 grams per day can help increase the intake of these prebiotic components. Additionally, there's probiotics, which I'm sure many of us have heard about, say from yogurt or kombucha or some of those other food sources that we've mentioned, or sometimes people take a supplement so that they're getting enough of these microorganisms that can act and protect the gut, improve digestion and gut function. What's very interesting is the probiotics, they're like food for the gut. Think about it that way. Kind of like when you feed your fish, right? You need your fish to thrive in the tank. It's the same thing where the probiotics that we're giving, we're supporting those microvilli and all those different components of our GI tract, right? So the prebiotics and the probiotics, they work synergistically to optimize gut health. We also have omega-3 fatty acids, which is an essential fatty acid, or what's known as an indispensable fatty acid, meaning you can't disregard it in your diet. You need it. You have to take it from foods, and that helps with reducing inflammation. It's a suppressive mechanism, and omega-3 fatty acids can be found in fatty fish like salmon. I will have a meal guide that you can download. I'll provide you with the link. It will give you a listing of many of these foods that you can choose so you know which one's right for you. Vitamin D, I'm gonna talk a lot more about vitamin D. I talked about it in my last presentation. Very powerful nutrient. If you don't have vitamin D in your cabinet right now, I highly recommend either go online, order some right now, or after this presentation, put your mask on, go to Walgreens and pick up 1,000 units of vitamin D. I'm gonna show you some really, really, really interesting information that just came out on vitamin D. It's no joke. So we know vitamin D is fat soluble vitamin. We know it as a calcium absorption nutrient. It helps with immune function, muscle function, and it has been shown to reduce the risk for respiratory tract infections. Additionally, vitamin C is super important. also known as ascorbic acid. It's a water-soluble essential vitamin necessary for collagen synthesis, hormone function, neurotransmitter synthesis, and acts as an antioxidant. Zinc also is very important for immunity and has a role in supporting protein synthesis, DNA synthesis, and cell division. Getting into vitamin C a little bit more, anyone can name some vitamin C rich foods in the chat. We know, again, that vitamin C is a very powerful antioxidant, again, quenching those free radicals and reducing cellular damage. We also know that we need at least 75 milligrams of vitamin C for females and 90 milligrams for males. Oranges, carrots are some foods that were mentioned. We may find vitamin C in, say, yellow or orange colored fruits or vegetables. We know that when you have a cold, vitamin C levels actually decrease. So you need more vitamin C during this time to reduce the duration of a cold. So there may be a suggestion to take in 200 milligrams per day, especially when you first notice that you may have the signs of a cold or flu. It's recommended that athletes take vitamin C to help reduce upper respiratory tract infections. And the dosage in the literature has varied between, say, at minimum 75 grams or 75 milligrams per day, up to like 8,000 milligrams per day. Now, I wouldn't recommend that much. You probably want to keep your intake to no more than 2,000 milligrams per day. And you really only need to increase it a lot when you find that you're having symptoms of a cold. You don't need to take it at a high dose, like 500 milligrams per day, if you don't feel any sickness. So eat plenty of vitamin C rich foods such as these here, and make sure you're getting your daily value. And then if you find that you're getting a little bit sick, then that's when you start to consume a lot more vitamin C to reduce the duration of a cold. So what foods have a lot of vitamin C? We had some responses in the chat. Red peppers actually are one of the highest sources of vitamin C with 95 milligrams per day. That'll meet 100% of your daily needs. Orange juice at 3/4 of a cup is perfectly enough to meet your vitamin C needs. Oranges have about 70 milligrams or 78% of your daily need. Grapefruit juice, has 70 milligrams. That's about 78% of your daily need. So I'll send this list out to you so that you can identify the top 10 foods that you should be consuming in your diet on a day-to-day basis. Now, getting into vitamin D, we recognize that we might consume enough from the sun. Maybe 80 to 100% of our needs are provided from sunlight exposure, but there's a caveat to that. It depends on your geographical location. For example, during the winter months between, say, September through April, if you live anywhere above the Atlanta line, there's no way that your body will create any vitamin D from sunlight exposure. Additionally, it depends on the time of day. So between 10 a.m. to 3 p.m., that's the optimal time frame by which vitamin D can penetrate the skin and increase vitamin D production. Additionally, it depends on what you're wearing. If you're covering your arms and face and so forth, and the sun doesn't have an opportunity to touch the skin, then you won't make any vitamin D. So those are important, and you can't make it through the window. You have to actually be outside. So unfortunately, there are many people in the United States that are vitamin D deficient, even when getting adequate sunlight exposure. We don't really get a lot in our diet, honestly. Maybe some oily fish or egg yolks. I'll show you some vitamin D rich foods in the next slide. What are some vitamin D rich foods that you might identify or that you're familiar with? If you can type it into the chat box. Additionally, when looking at how much we need each day, the daily value that's suggested is about 600 units per day for adults under the age of 70. If you're over 70, it's recommended to take in 800 international units per day. Unfortunately, with age, we have some decrease in our ability to absorb nutrients, so we need a little bit more than usual. These amounts have actually been modest, and studies have suggested increasing the dose. I personally take about 2,000 to 4,000 units of vitamin D per day. Additionally, we know vitamin D has many roles, from calcium absorption bone homeostasis, immune function, muscle function as well. So salmon was listed, milk was listed as a vitamin D source. Thank you. We see that cod liver oil, 1 tablespoon, actually gives you a very high amount of vitamin D. I think that's kind of old school. No one really does that anymore, but if you want to resort to it, it could be a great way to meet your vitamin D needs. Rainbow trout, farm rainbow trout, 3 ounces provides over 81% of your daily value. Salmon, 3 ounces can also give you 71% of your daily need. And again, I'll send this list out so that you can have it. But you'll recognize, I'm sure, many of us don't eat these foods on a daily basis. You got to be eating these foods every day, at least 600 units, in order to have adequate vitamin D intake. So unless you're eating trout every day or cod liver oil, then there's a risk that you'll have deficiency, which is why supplementation is so necessary. Here's a recent study that just came out on May 5th stating overwhelming evidence supports vitamin D's immune function benefits. There's a lot of reports coming out about vitamin D and its role for respiratory tract infection reduction, immune support. I'd like to know in the chat if you're taking vitamin D right now, can you say yes and tell me how much? So I'm personally taking vitamin D, and I will put my response in, and I'll tell you which one I'm taking. All right, so we got a few yes in there, 125 microgram, yes to a few others, 1,000 units, awesome. So get that supplement, take that supplement every day. There's very minimal risk factors to taking vitamin D, especially at 1,000 units per day. Now, when looking at some of the more recent studies in regards to COVID-19, this information just came out as well. This is a chart from April 21st, 2020. What this chart is basically saying is that the severity of COVID-19 symptoms was based upon the vitamin D level, and they looked at over 212 individuals. So we see here, those who were more critically ill, 52 of those individuals had a vitamin D level below 20 nanogram per milliliter. 44 individuals had a mild vitamin D level, still insufficient, and only 4 individuals that were severe had an adequate vitamin D intake. And then when we look at those who had a severe COVID-19 response, there were 56 individuals, 55 had a very low vitamin D level, 41 had a low vitamin D level, and then 4 had a adequate vitamin D level. And then if we jump over to mild, this kind of gives a pretty interesting picture. We see that 96 of these individuals who had a mild case had an adequate vitamin D level. So here's some evidence just showing how important and powerful vitamin D is. And then again, when we're looking at the general society based upon race, ethnicity, we know that vitamin D, for those who are more darker skinned, have a more difficult time making vitamin D because you need more sunlight exposure to penetrate the skin due to the melatonin. So when we're looking at variation in ethnicity, we see that blacks have 6% of blacks have adequate vitamin D levels, and that subsequently goes up in variability based upon skin tone, give or take. But even when considering that factor, we see that based upon the enhanced data from 2013 to 14, this was over 5,500 individuals in the United States. They found that 13%, only 13% had adequate vitamin D levels. So it's incredibly important to supplement. All right. So I see some are taking very high doses as well. Sometimes if you've had inadequacy, you might have to take a very high amount of vitamin D. All right, well, now we'll get into these immune enhancing supplements a bit. And I looked up a couple of things here. There's this first supplement, and I really don't know how to pronounce this, pelargonium, something like that. Well, if you see this one as a reported supplement to consider, there's some information showing that it may help to prevent bacteria from attaching to the throat and lungs, suggesting that you should take it at the onset of illness. Again, any of these suggestions, always make sure you check with your physician, make sure there's no interactions with medications, but there was some implications that this might be a supplement that people take that might be helpful to prevent bacterial infections. Echinacea is another one that I'm sure many have heard of. It is affiliated with enhancing the immunity. They recommend for it to give you the best benefit, you have to take it year round. And I have more specific information about these nutrients on my blog, where I talk about exactly how much of it you need to take each day. You want to be careful not to take any raw echinacea, as it does have a poisonous molecule that can be very risky. So only use a high quality manufactured echinacea supplement to improve outcomes. Or I'm sorry, elderberries. That was for elderberries. So elderberries are also associated with antiviral properties and may help with inhibition of influenza, and is suggested to take it at the first onset of symptoms. And then there's another supplement known as NAC, which is affiliated with reducing mucus production, can help thin mucus secretions, and may be taken as well as a supplement. I was wondering if anyone in the chat box have taken any of these supplements or any others to help with immune enhancement. Now, when looking at exercise and immunity, this is another factor that's important. There's research showing that our white blood cells are on our red blood cells, and without physical activity, they're kind of dormant, right? They're kind of chilling, like sedentary lifestyle, just chilling on the couch, not really, they're not working out, right? They're not like Tyson. So when an illness or something of that nature comes into play, it will be like, kind of lethargic in relation to trying to fight off that infection. But studies show that when you start exercising, those white blood cells, they can get off of the red blood cell. Now they're more ready to fight again, more like Tyson, like, okay, I'm moving around the body, I'm moving around the red blood cells, I'm checking out everything, making sure everything's good, I'm ready to roll. So physical activity can play a role in enhancing those white blood cells to be more alert and ready to fight off infections. It's suggested that we exercise at least 1 to 2 hours a day, which is affiliated with reducing the risk for infections by 30 to 50% in relation to those who are sedentary. The intensity and duration of your exercise also influence your immunity, either in a positive or a negative way. So if you're exercising for a longer period of time, 1, 2, 3 hours, you want to make sure you're using nutrition, supplementing with a carbohydrate-rich beverage, because your body actually becomes fatigued and your immune system needs that energy so that it can keep fighting. So, a post-workout supplement, a protein shake with some fruits would be helpful. So like marathon races, things of that nature, you want to make sure you're taking adequate nutrition. For example, for marathon runners, to reduce upper respiratory tract infections, it's recommended that they take like a glutamine supplement, 5 milligrams per day or 5 grams per day, 5 to 10, to help reduce that upper respiratory tract infection. Glutamine is an amino acid. And there are studies showing that for those who are sedentary for more than 10 hours per day, I know we're in the house, during this quarantine, but studies show when you're inactive for more than 10 hours a day, it's associated with a 34% increased risk for mortality. So it's very important that we become active and get up and do something to help support our physical function and immunity. And then we also know that too much of anything isn't good for you, which is why I put this slide up, just showing when you're sedentary, your risk for mortality goes up. But as you are moderately exercise, your risk for infection, decreases. And then as you increase intensity, you're working out so much that can actually increase your risk for infection as well. So a good balance is important. So we got about 10 minutes in summary. We want to avoid excessive intake of immunosuppressive drugs, alcohol, and other factors. We want to eat a diverse diet filled with plenty of fruits, vegetables, fiber, fish. And we want to use good food preparation practices and avoid those AGE, advanced glycosylated end products that are found in foods. And we want to make sure that we're getting a moderate amount of exercise. I also have an affiliation with Inside Tracker where they have an immunity test that you can actually make an assessment for where your immunity stands now. Look at white blood cell counts, CRP levels, and some other factors such as how sleep is affecting your immunity, stress factors like cortisol. And I do have a 25% discount by utilizing Immunity James. And I will put a link into the chat box where you can actually download my meal guide for free. This has a listing of all those foods I mentioned that are affiliated with supporting health. So you can go to that link, put your info in, and it'll send you the link to download immediately. So with that said, we have about 10 minutes. I'd like to open it up. Any questions, comments, come up off of mute and we'll have a discussion.
James, I wanted to ask you a question. You spoke about sugars and different, factors in that they play. Can you recommend any sugar replacements? Because I know sugar. Well, what I think I know about sugar is it's not good for you at all. Do you have any replacements that people can use other than like the basic stevias and other things like that? Like, for instance, agave nectar. Sometimes I use. Is there anything other than that that will kind of lead us in the right direction?
Certainly, sugar is always a sensitive topic and kind of difficult to assess as far as what sugars are best. We all know that white table sugar is going to be the worst for our health. And there can be added sugar that we might put into our coffee or tea, but then there's also the hidden sugar that might be in our cakes or cookies. Now, we want to use, as an alternative, we're considering, say, honey, agave nectar, and others, but we must be mindful of the calorie content of those food sources as well, as when we're looking at metabolism, whether it be agave nectar, honey, white sugar, or others, they're going to still break down and digest into the same molecule, which is glucose. So there are some different charts and resources that can help you identify which of these sweeteners have a greater concentration of sweetness so that you're using less of it. So for example, a honey or agave nectar might be more sweet, give or take, than white sugar, so you're using less of it. And you might be able to, say, use some different ingredients in your baking or cooking so that you're reducing the total amount of sugars in your diet. Sorry about that, my pit bull is going crazy. But generally, you also can look at, man, she made me lose my thought.
Okay.
Oh yeah, artificial sweeteners, right? I know that kind of gets a bad rep as well. Generally, I'm an advocate of considering their use. I did see or recognize some studies suggesting that it could have some influence on the microbiome or your gut. But again, you want to counteract that with good fruit and vegetable intake. But personally, I'm more of an advocate for using some of those artificial sweeteners to help reduce the calorie intake. So that could be something to also consider. So like your Splendas and your sugar-free beverages or food sources.
Perfect. I had just one last.
One comment I have on that. Yeah, sugar alcohols also can be considered. One thing that you have to be mindful of is just check the tolerance, because those sugar alcohols can have more of a risk for GI distress. So, use a little bit of those sugar alcohols at a time. And that could certainly be something of consideration, as they're not absorbed into your body. So that could be helpful.
One other thing that you spoke about was mucus. And like I said, I do a lot of research, but I don't know if the research is how valid it is. But something that I was reading that is, they said like, there was a theory that mucus is, I want to say, accounts for maybe 90% of disease or bacteria or sickness in our bodies. Is that true? Like the mucus forms around stuff and it just blocks, and just so mucus is not good at all?
Well, I wouldn't say that it's not good. When looking at gastrointestinal function in the gut, I recognize mucus as being a benefit because it's affiliated with protecting the lining of the GI tract. It actually acts as a barrier. But when you're talking about mucus secretions that are increasing, say, in your throat or from your lungs, that's where it's more of a risk factor. And it gives an indication that you're getting an overproduction of mucus, which can give an indication for that hyperinflammatory state. So I think it's a fine balance, and I think it has an intention. But when we're seeing that it's appearing in the lungs at an excessive rate, that's where I think it's more of a bad thing. Obviously it makes it harder to breathe and things of that nature.
Is there anything that we can do when we recognize an overabundance of mucus, whether it be secreting from our eyes, ears, or wherever else, that we can do naturally other than like the mucinex or things like that? Any foods? Because I believe I heard that, and you can help me with this, like dairy and cheese is not good to eat while you're having abundance of that.
Certainly.
Is that true?
Yeah, certainly. There's some indications that, dairy products might be more of a mucus producing food source. So you might want to avoid those during a state of increased mucus production. There was a recommendation perhaps to use more vitamin C rich foods like, say, lemons with your water to help cut the mucus and thin out some of those mucus secretions. You want to increase your fluid intake, of course, to also help with reducing those mucus secretions, and eating, those foods that are more thin, like teas, etc., to reduce that mucus secretion and help break down the mucus buildup. I also noticed there was a question in the chat.
Yes.
A local honey. Certainly, I don't know a lot about the mechanism and how that works, but certainly if you have, say, allergies, they recommend taking local honey as a way to help reduce seasonal allergies. I know down here in Texas, I'm from Connecticut, which has a lot of trees. Actually, Connecticut has the most amount of trees per capita. I realized that back in the day, I went to Phoenix, Arizona, and it was like all desert. And then we flew back to Connecticut, and I've realized how many trees we had. Well, when I came down to Texas, the doctors told me that I would have bad allergies when I moved here. And I was like, this guy don't know what he's talking about. Now, I've been here for 5 years, and my allergies this year have been a nuisance. I have to take the Zyrtex or whatever it's called to help reduce, those histamines. But yeah, honey could be a way. And there's another question, if I can provide a brand suggestion for vitamin D. I use the Max Fish Oil product, but you could also go to, labdoor.com and receive a listing of vitamin D supplements that have been checked. I think Nature Valley might be a good supplement to consider. I think most of the over-the-counter vitamin D products are fairly adequate when it comes to vitamin D product, but check out labdoor.com. I think this one will give you a listing of supplements to consider.
James, there was a question about caffeine and your thoughts on it. Good, bad, how much, how little?
Yeah, certainly. Caffeine, I'm all for it. There's great research showing that caffeine can be beneficial for several different factors besides keeping us alert and helping to reduce the risk of falling sleepy during work. It helps to burn fat. It's actually a lipolytic, where it activates the body to break down fat. And I believe I've seen some information in regards to caffeine to support immunity. So 200 milligram of caffeine per day, you can get that from 2 cups of coffee. You could also consume tea, which would be a way to obtain some caffeine as well. Of course, everything in moderation. If you consume too much caffeine, obviously you might run the risk of, what do they call it? Tachycardia, where your heart rate goes off whack. Additionally, in relation to caffeine, people think about it as a diuretic, like, oh, it's going to cause dehydration. But as long as you're staying under that 200 milligram or 180 milligram mark, it will not have an influence on hydration status. In fact, I would actually encourage it in a cup of coffee or tea, because you're getting that fluid intake to support your overall hydration status.
Awesome. I think there was one last question on nutrients and weight management, or?
Yeah, I see this one here. So there was a question: what supplements can you suggest for someone who has suffered significant weight loss to help build nutrients? So in that regard, I would probably recommend considering a supplement like a protein shake, like Isosource, as an example, is fortified with several vitamins and minerals. You could also consider utilizing a ready-to-drink oral nutrition supplement that has vitamins and minerals that are fortified. Full disclaimer, I work for ACUTE, so I'm gonna recommend Ensure Max. That one can be a 30-gram high-protein product, and those can be considered. Also, having a consult by a dietitian so we can analyze your diet, see where you may have deficiencies, and increase the intake of those specific foods. There's also a resource through this Inside Tracker company where they can actually look at your blood and assess for specific nutrients to see if you have deficiency. I actually just had a testing done where I was able to see like what nutrients I was deficient in. That way you're focusing on those foods to help with improving intake.
That's awesome. So in essence of time, it is we are running short on time. So I wanted to take care of just a couple logistical things. First off, I wanted to thank you, James, for your expertise and your due diligence and just your hard work and efforts to try to get this great information out to everybody. And thank you for joining us today. I do want to remind everybody that this is just part 2 of a four-part series on health and wellness that James will be providing for us. He will be back next Saturday, May 16th, for weight management and diabetes as part 3 of our health and wellness series. I also want to remind you of Monday Table Talks with Equity CT. This week we will be covering APIDA, which is Asian Pacific Islander Desi American, and that covers xenophobia, some of the racism that has been occurring due to the COVID-19 virus. And that will be at 6 p.m. Tuesday, May 12th, we have Sound Healing with Kelvin Young. He is a licensed sound healer. So I think that's going to take care of people's anxiety and just stress. It's more of a holistic meditative practice. I'm interested in finding out more about that. He's a great person, so we're looking forward to that. Join us. Thursday, May 14th at 3 p.m., Jimmy O will be back for his Coping with Change series. And this week's topic will be how to develop an entrepreneurial mindset. And everybody will get the links and the flyers for that. Friday at 7 p.m., we will be continuing our Cultivating Conversations with Equity CT. And we will continue to just discuss multiple various topics such as masks, COVID-19, and just leadership accountability. And so we have a lot of programming that we will be offering throughout the next few weeks. And thank you for supporting Born Rich. Please go to jameslucasnutrition.com for any guidance that you need, or if you want to connect with James or we can connect you one-on-one. Go to the chat box and fill out the survey, and I will send those to your emails and phones as well. I just want to thank everybody for joining us on this Saturday. Make sure you get out and get some activity and do what you got to do. So I appreciate you all. Stay connected. Thank you for supporting Born Rich. Thank you for supporting James Lucas Nutrition. Thank you to Nithya from Ask Nithya for coordinating everything. And also I want to thank Jimmy O, president of the board of directors on Born Rich. And we just want to thank everybody for joining us today.
Thank you. Thanks, Rich. Peace
All
out.
right, everybody. See everybody soon.